Well, good Tuesday morning. Welcome to the WLBB Community Voice program here on News Talk 1330 FM 106.3. Also streaming live online at newstalk1330.com. And this morning we're on the News Talk 1330 WLBB Facebook page. Thanks to Joel Brock for handling those duties for us this morning. Steve Graddick is punching the buttons. And a very special show. Haven't had the opportunity to talk with this young lady in, I think, a couple of months. And I believe this is hopefully a good news show. Mostly good news show, but it will be a reminder of what's going on. Medical Director of Infection Prevention for Tanner Health System, Dr. Laura Larson, our guest on this morning's Community Voice program. She's also the chairman of the Carroll County Board of Health. And going to do a review over the last year and several months and kind of get a good idea where we are right now. Dr. Larson, good morning.
Good morning.
And appreciate I'm glad that we get a chance to talk to you. And I'm assuming this is a good time. And I was even joking to Steve after I punched you through the board this morning that she sounds like she's in good spirits. So maybe that's a sign of it's a good positive sign of where we are maybe as far as this whole thing.
Yeah, I think we're in better shape than we were over the last year right now for sure.
Absolutely. Good. Well, update us. First of all, let's promote the fact you guys do have a walk-in vaccination event that's going on tomorrow, being Wednesday, right?
That's right. That's going to be tomorrow from 9 a.m. to 3 p.m. at Tabernacle Baptist Church. And we'll be administering, I believe, the Pfizer vaccine at that event. And so that will be a vaccine two-shot series for that one, as well as the Moderna is also a two-shot.
Mm-hmm. But this will be for the first shot for people. If you got your first shot someplace else, it's probably not best that you try to come be part of this, right?
I don't really know. I didn't clear that information with my vaccine team to know if that's the case. It would be something that if you go to tanner.org/vaccine, or maybe I can get back to you and post something on the Facebook page about whether or not you're looking for a second shot, if that's an opportunity for you or not.
Okay, you know that your marketing team, they're probably listening and working on that right now. They'll probably post
Probably. They're fantastic.
Absolutely, up on our Facebook page. So, again, that's tomorrow from 9 till 3. You don't need an appointment, and it'll be at Tabernacle Baptist Church. So it's pretty easy to get the vaccines at this point for the groups that are putting those out, I'm guessing.
It is. It actually is. And we've even gotten feedback from the state that the demand has finally, settled and the supply is there.
Are you aware of, having to toss any that just haven't been able to get use in a timely fashion at this point?
Almost never. Fortunately, we're very careful with how we draw up vaccine during the day because, we don't draw up 2,000 and then expect 2,000 to show up. We draw up enough that we know we have appointments for, and then we thaw and draw up more as we go forward. So we waste very few. It's a precious commodity, so it's something that we're very careful with.
The occupancy at the Tanner hospitals was always a number that we would watch throughout the early part of this, and I'd say many of us have kind of not watched it as much as we did early on. But what are these statistics as far as the occupancy in the hospitals at this point?
Right now, as of yesterday's numbers, we had 10 patients in the hospital with COVID, and that was for all of our hospitals. So that's a good number. We peaked in the 80s of having over 80 patients in the hospital with COVID. So we were lower about 2 to 3 weeks ago. We had single digits. We've seen a little bit of an uptick in hospitalizations and a little bit of uptick in cases, which we really expected based on the information that we received from CDC about being worried about spring break and people getting together. So we have seen a small uptick, but fortunately, it's not been dramatic.
So close to 1,800 admissions related to COVID since the pandemic began at Tanner hospitals, right?
Yes, that's right.
Yeah. And I guess the condition of the people there in the hospital right now. I mean, it's more than you just coming in with the sniffles. I mean, they're
right. I mean, these people are sick to be here. Because fortunately, most people that get COVID don't have to be hospitalized. But the overall numbers tell us that 15 to 20% of people that get COVID can need to get hospitalized, and certainly the ones that end up in the ICU are usually very, very sick. We've had some very sick patients this week in the ICU.
And one of the great things about the vaccination that we're hearing about is that it definitely significantly lowers the chances that you're going to get as sick as you might have a year ago.
Yeah, that's the main, we always sort of find out after the fact what the main goal of a vaccine is. Like the main goal of the flu vaccine is not to prevent flu, it's to prevent death from pneumonia. And so that's what the goal of this vaccine is too. It's really to prevent you're getting sick enough to die or getting sick enough to even be hospitalized. It's been very successful with that. And even just for the efficacy of getting COVID is higher than most vaccines ever. Something to be in the 90% range is more or less unheard of for a vaccine.
Mm-hmm. How many vaccinations has Tanner given out since they were starting? It was the beginning of January? Yeah. You guys started putting them out in December, actually, right? Late December?
We did. December 22nd or 23rd. I remember because that was a really, really happy day. I went down to the pharmacy and met with Lynn Barrett, and we opened the first box. It was very exciting. So, yes, we've given over 20,000 vaccines. It's 20,200, and over 16,000 of those have been to the public, so 16,400 vaccines to the public.
And right now, if anybody's 16, age 16 and over, is eligible to get a vaccine.
That's right. And right now, the ones that are licensed for 16 and 17 are the Pfizer vaccine. If you're 18 or older, you can get the Johnson & Johnson or the Moderna.
Are you still seeing some concern as far as the Johnson & Johnson vaccination? Are people still hesitant to do that more so than they are at the vaccine period?
I think there's always some vaccine hesitancy across the board. When the CDC and FDA put the pause on the Johnson & Johnson vaccine, I had already read there's something called, if you want to get the most detailed information about the vaccines, go to find their FDA emergency use authorization. You can Google that. You just Google, Johnson & Johnson vaccine, FDA, EUA. It gives you specific information about what's in the vaccine, what the clinical trials showed. And even in the beginning, the clinical trials showed that there was a mismatch in the number of people with clotting events. They didn't know it was statistically significant at that point when the vaccine came out. So what they did see is, the vaccine rolled out, millions of doses were given, and 6 people developed serious clots after the vaccine was given within the first 2 weeks of the vaccination. So that's a very, very rare event, but it was updated to include that warning. Mm-hmm. So the advantage of the Johnson & Johnson is that it's a one shot and you're done. The efficacy is lower for prevention of COVID, but still very high prevention of severe COVID. And it's been a good vaccine for people that are afraid of the side effects of getting a second vaccine. And then for people that have had COVID before, many have elected to get the Johnson & Johnson because they know they're going to have a reaction to just one as well. But the clotting events are extremely rare. But I applaud the FDA and CDC for being transparent, pausing it, looking at the data very carefully, and look to see who got it. What they specifically have said is that women under 50 may be, those are the higher risk of clotting events. And so that, most of the people in the trial that got the clots were women, the ones that were studied. So it's just important to know a little bit about everything. I would rather even people, there was just an article in the media yesterday about a lot of people who gotten a first shot and not a second shot with Pfizer and Moderna. I mean, I'm happy for anybody to get a shot at this point because it's just what I'm hoping is that we just get enough herd immunity and vaccinations in arms to where we don't have a variant that wreaks havoc. And that's the other shoe waiting to drop is, could we get a variant come in and start this process all over again? And I hope that we can get enough vaccines to and people to where that's not an issue. I just don't think we can do another year like this, And
I certainly want to go back and talk about herd immunity and people taking that single shot. I want to talk about that more in the program. But let me go back to your vaccination event tomorrow, and hopefully you do know this as far as presenting an identification, because not a 16-year-old. It does say bring an identification, but not all 16-year-olds have an ID or 17, and maybe didn't get their license this past year just because of COVID. Is that a requirement to present an identification if you're 16 years old?
I think what we've been doing is having a parent there because, if you're 16 or 17, you're not an adult. And so if we require a parent there, I'll let my media marketing team chime in on the Facebook page about the identification for that. But I would imagine if a parent was there with identification, potentially, I don't really know.
Okay. And before we do take our first break here, and after we do take our break, I'm going to go to our Facebook page and see if there's some questions and comments that I can share with Dr. Larson. I'll do that during that break. But you guys do have additional upcoming vaccinations. We do encourage people to take advantage of the one tomorrow here in Carrollton, but I'm assuming you have some other ones that are in different spots and maybe might be more accessible for other people.
We do coming up. And, the best place to look for that information is the tanner.org/vaccine or the tanner.org/take my shot.
And making that second getting that second shot is really easy. I mean, I understand most places I've seen you've been able to do it that day. You get that first shot, and you're able to go ahead and set that second shot. Maybe
that's
was it
exactly
3 weeks
right.
later?
We've been very proactive about making sure that second shot is scheduled.
All right, Dr. Laura Larson, our guest on this morning's Community Voice program, Medical Director of Infection Prevention for Tanner Health System, also Chairman of the Carroll County Board of Health. Time right now is 8:39. We will take our first break and come back and continue our conversation. Community Voice brought to you by Tanner Health System, Oak Mountain Academy on News Talk 1330, FM 106.3.
Travel, get-togethers, Sunday morning worship. COVID-19 has almost put a stop to our way of life. Vaccination is our best shot at getting back to normal. The COVID-19 vaccine is based on more than a decade of research. Trials show it's safe and can provide up to 95% protection when you've received both doses. Tanner is committed to making the vaccine as widely available as possible, giving you a shot at getting back to life. Until then, keep wearing your mask, washing your hands, and avoid gatherings. Learn more and get updates at tanner.org/vaccine.
At Oak Mountain Academy, our academic excellence shines through innovation and a personalized educational experience. Our pre-K 3 through 12th grade environment offers a family-oriented atmosphere. We are an independent school with faith-based values and an academy honor code. Our academic standards prepare our students for college and beyond. I'm Patrick Duran, headmaster, inviting you to visit us on the mountain or at oakmountain.us. Come see how our warriors are creating legacies.
Time right now is 8:40. Welcome back to the WLBB Community Voice program here on News Talk 1330 FM 106.3. I'm your host this morning, Colin Worthington. We're also streaming live online at newstalk1330.com, and we are on the News Talk 1330 WLBB Facebook page. Our guest this morning is Medical Director of Infection Prevention with Tanner Health System, Dr. Laura Larson. Looking through some of these questions on our Facebook, the debates do still rage on here for some of this stuff, and a lot of these questions, I would assume it's not something that Dr. Larson would want to contribute. But let me ask you, how do we feel about masks at this point, and masks for the youth?
I'm still wearing them.
Mm-hmm.
My children are still wearing them. I still think they're necessary. We're still seeing people get COVID sick enough to die. So, it's one of those situations where if you're vaccinated, obviously you have a little bit more protection. But, that's what I mentioned earlier is the million-dollar question is we can't see variants. We don't know when they're in our community except for when they get tested for, and not everyone that gets tested for COVID gets tested for a variant. So it's one of those things that I still feel very strongly about masking right now because it's just not over, and we're still seeing serious cases. Obviously, I'm very biased because I see serious cases in the hospital, and I see patients die. But it's one of those rare events. But you just don't want it to be you. And so it's just like wearing a seatbelt. It's a very rare event to have a car wreck and die, but it happens. So that's why we wear a seatbelt. And I liken a mask right now very much to that form of protection.
As the chairman of the Carroll County Board of Health, do you look at the numbers in the schools as far as, Carrollton City chose to keep masks on, and the other schools it was just, strongly urged or suggested even. Were you able to compare those numbers? Because, you look at the county system, county-wide, the numbers were obviously significantly higher, but they're counting all the schools than that one. But was that something that you guys, as the Board of Health, looked at to pay attention
to? We looked at the numbers. We didn't look at the percentages per se, because it's one of those things that we never felt like it held, a critical threshold. And there's so many more students in the county schools. So it was one of those things that we definitely looked at the numbers, but we didn't look at the percentages to see, we did see a higher percentage of students getting COVID in schools that did not have a mask mandate. We did indeed see that. But, I think all of the schools in our area did a good job at trying to keep people safe. I really do. I worked with Carrollton City. I worked with Carroll County. I worked with Bremen City, Haralson County, all of the schools, Oak Mountain Academy. All of the schools had very good plans in place on how to manage it. Some of them did it differently, but I think all in all, everyone did a really good job.
You'd mentioned the potential for variants, if we don't find herd immunity quick. But what do we know about potential variants, and what does that mean for folks who are already fully vaccinated and maybe those who are not?
A variant is just a different virus that's mutated, and it's different from the ones that we've seen. And so a variant could potentially mutate enough to be infectious to people that are already vaccinated. And so the reason why it's important for people to be vaccinated and people to have immunity is that you can't transmit virus readily. And the more readily you transmit virus, the more opportunity the virus has to mutate. So if you can stop that process, you decrease the risk that a variant is going to emerge. And so the countries that we're worried about right now with variants emerging are India and Brazil. So hopefully those events won't happen.
What does we're having an emergency test of EAS right now, so I don't know if you can hear that alarm going off. But what role does Tanner play, and maybe other places you can get testing? What role do they play in helping to identify patients who've been infected and maybe fallen ill to the mutations? Is there documentation of that or required?
No, that's something that's just done more with public health and larger research labs. So just like flu season, and during flu season, I've signed up to be what's called a sentinel provider. And so what you do is I test 3 people with flu a year, send that to CDC. CDC does specialized testing on it. So there are mechanisms in place to do the same thing with COVID, but not everyone that gets tested for COVID gets tested to see if there's a variant. And the way that we know, we had variants in this country before we even knew we did. And, those, it was the UK variant and then the South African variant, and there are more in, California. I don't know if you've seen, we've had to change the way we treat people with monoclonal antibodies because we first got our monoclonal antibody, and this is a treatment for people that have COVID that aren't that sick yet but are at high risk for getting sick that we give them to as an outpatient. But we were giving bamlanivimab, and now we've had to add a second monoclonal antibody because the variants are susceptible. It doesn't work. The bamlanivimab doesn't work with the variant species that we're seeing in this area. So we've already, they were already here before we even were able to test for them. So there are mechanisms in place to test for them, but it's almost a lagging process a little bit because things are being transmitted readily in the community. It's hard to catch those because no one has the capability to test everything for a variant because you essentially have to sequence the virus, which is laborious.
Yeah, no doubt. We had mentioned early on in the show 10 inpatient admissions at this point is where you guys are at this week. Are the treatments, have they changed since early on? How much have they changed, and what are the actual treatments going on right now?
So still the base treatment is remdesivir and Decadron, steroids and remdesivir. We are hoping that there's a new antiviral coming out in pill form that's been very efficacious that's in clinical trials right now. But other than that, and the monoclonal antibodies for outpatients, we don't have really a lot of new medications on the horizon except for that one single pill that we're hoping gets approved for emergency use as well. So the best treatment right now is to get a vaccine to prevent severe disease.
Dr. Laura Larson, our guest on this morning's Community Voice program, Medical Director of Infection Prevention for Tanner Health System, also Carroll County Board of Health Chairman. We did talk about herd immunity a little bit and wanted to save it for later on in the program. Discuss that with us, please. Define exactly what that is. What does it mean, and how will we officially know when it's achieved? There's a local doctor, a local medical group that believes we have achieved it just based on studies they're doing. But what can you tell us about exactly what it is and why should we be hopeful for it, and I guess what it means for the future of us staying well?
Sure. So herd immunity will be enough when we're a herd of people, and when enough of us are immune, either by vaccination or by infection, to where we don't have a lot of active transmission of virus in our community. We still have active transmission of virus in our community. Our percentage of people testing positive still is not lower than 5%. It's around 8 to 10%. So we haven't achieved herd immunity because we're still having ongoing infection. We're still having ongoing hospitalizations. We're still having ongoing deaths. So we're not there yet. I would say we have herd immunity when the herd doesn't get infected anymore. Mm-hmm. We're just not there.
Well, what about the perspective of a certain number of people having antibodies? Whether it's from the actual vaccination or because they had the virus previous. Is there a percentage there that would equate herd immunity?
What we're hearing from the FDA and CDC is they're expecting herd immunity to be later this summer, and numbers higher than 70% of the community having antibodies. For most infections, herd immunity is having antibodies, 90%, and we're just simply not at that point yet.
Well, recent reports say as many as 5 million people have received the one dose of the vaccine, but have not followed up for a second dose when it was scheduled. Do you think this will help us help keep us as a country from reaching herd immunity? Or I know you don't want to say, hey, no, it's good. The one's better than nothing. But how much would that affect us from reaching herd immunity?
It's hard to say yet. We haven't had the data come out to really look at that number. There have been some promising reports coming out that people having, it being 70% efficacious for preventing COVID with a single shot. So I think the jury is still out on it. I would, I have to say one shot is better than none. And obviously completing your vaccination series is going to be important for, I think, certain things going forward. And we've gotten information from the European Union that they're going to allow American travelers back that have been fully vaccinated. So if you've gotten one shot, that's not a full vaccination series. I think there are going to be other implications for not completing your vaccine series.
Is one shot of the vaccine kind of equal to what we're used to as far as the flu shot in relation to efficacy? Anyway?
Yes. Yeah, the numbers are about right. Flu shots vary every year, but, typically in a flu, a flu vaccine is roughly an average of about 70% effective, and that's about the same for a single shot of COVID vaccine.
What are the reasons for people with vaccine hesitancy? I'm sure there's reasons why people, they have something else scheduled, can't make that second appointment. But are we seeing vaccine hesitancy, and is there, do they have real reasons that they're talking to you about, and what do you tell them?
Yeah, there's a wide variety of reasons. There are people that believe that there's a micro tracker in the vaccine, and we certainly have no data that is indeed true. There are people concerned about fertility. We have no data that the vaccination affects fertility. In fact, we, in the early clinical trials, we had patients get pregnant after vaccination. And I don't have specific numbers, and no one does, on what percentage of people get pregnant, but we don't have any data that fertility is affected, but that information is very widely out there. We have hesitancy of just worried about the second shot being worse than the first shot in terms of side effects. And then, there are some people that have had, I know of the 20,000 vaccines we've given, we've not had any cases of anaphylaxis. We've had 2 cases where people had to be hospitalized for their counts dropping, which is a very rare event. So, it's one of those things that obviously if you had a side effect significant enough to where you felt badly with the first one and you felt strongly about not getting the second one, that's what we're typically seeing with hesitancy is having a reaction the first time and fear of having the reaction the second time. Those are the most common things that I'm seeing with hesitancy.
Now, I've had the first Pfizer shot and waiting for the second one, but honestly, the more people I've talked to over the last couple of weeks about that second shot, they're really, initially I was hearing about, chills and then just being knocked out. And the one guy said he felt like he was hit by a truck, but I heard that like 2 months ago. I don't know why it would change in 2 months, but honestly, the people I've talked to the last 2 months said that really the second shot was nothing. They're not experiencing
I've heard the same thing. And I've been involved with clinical research at Atlanta because that's where I got my vaccines last September before I knew, they were blinded at that point, but I know I got them now. They said the same thing, that there is no rhyme or reason for it, that some people do great with the first shot, bad with the second shot, bad with the first shot, then great with the second shot, that there's just not really. The only thing that seems to hold fast is that if you had a significant case of COVID and you got vaccinated, people that tend to have a stronger reaction if you have previously had COVID.
Then that's one of the questions on your questionnaire. So you guys pay attention to that. Before I do take this final break, that we had mentioned this early on, the J&J vaccination. You'd mentioned, I believe, was it women 18 to 35 that were having the blood clot issues?
Yes.
Well, why is that? To determine why that group is affected? And
they didn't specifically say, but women in general are more likely in the years of of childbearing years. We're more likely to clot. I'm actually out of that age group now, but women in general are more likely to have clotting events in childbearing years than not. So I don't know if that's what's going to come out with that or not. I think there's still more information to come.
All right, we're going to take our final break right now, come back with about 5 minutes, and finish our conversation with Dr. Laura Larson, Medical Director of Infection Prevention for Tanner Health System. Community Voice brought to you by Tanner Health System, Oak Mountain Academy, News Talk 1330 FM 106.3.
Travel, get-togethers, Sunday morning worship. COVID-19 has almost put a stop to our way of life. Vaccination is our best shot at getting back to normal. The COVID-19 vaccine is based on more than a decade of research. Trials show it's safe and can provide up to 95% protection when you've received both doses. Tanner is committed to making the vaccine as widely available as possible, giving you a shot at getting back to life. Until then, keep wearing your mask, washing your hands, and avoid gatherings. Learn more and get updates at tanner.org/vaccine.
As a graduate of Oak Mountain Academy, I've found that my experience on the mountain prepared me beyond all expectations. As a junior at Auburn University, I approached my studies with great confidence thanks to what I learned at OMA. When I think back on my time on the mountain, I think of my teachers. Their genuine love and concern for me as a student was always evident, and now, as an adult, I still foster those relationships. I'm Carly Robinson, an Oak Mountain Academy alum. Visit oakmountain.us to see how you can offer your child an amazing opportunity to be a warrior.
8:54, wrapping up this morning's Community Voice program, News Talk 1330 FM 106.3. Our guest, Dr. Laura Larson, Medical Director of Infection Prevention with Tanner Health System. And try and get as many questions in and comments, too. A lot of nice comments for Dr. Larson on our Facebook page, and I always do like to share those. Dr. Larson, do we see this shot being an annual shot? Maybe you can't say for sure at this point. I guess, first of all, how about the booster shot? Can we expect that in the fall, and do we see us having to get an annual shot or annual two-shot in the future?
Right now, they think we are going to probably end up doing a booster, but the jury is just still out on that. If we can get more people vaccinated now, that may not have to happen. We just don't know yet.
All right, Angela Ashworth, her husband has a good-looking beard. She says she was prepared to be sick, making sure she didn't have anything scheduled, but she never got sick, just a sore arm. Tanner marketing team did clarify as far as the necessity for an ID if your age is 16 to 18, so go to our Facebook page and see that. Brett Hicks says, thank you, Dr. Larson, for all your hard work and care for our community during the pandemic. Let's see what else. Jenny Dollar says, thank you, Dr. Larson and Tanner, for taking care of us and your care for our public health, promoting vaccines. Let's see what else we got here. Thank you, Dr. Larson. This is Angela Ashworth again. Thank you, Dr. Larson. We are truly fortunate to have you in our community, and I encourage you to go there and check out where's those comments, and I'm sure they are with Tanner's marketing group and answering those questions that we haven't touched on here so far. If it appears that more affluent residents become vaccinated, is there something that Tanner can do and is doing to reach out to those underserved groups? And are you guys working to educate them about vaccines as well as providing barrier-free access to those in need? Because not everybody gets the opportunity to listen to this program or check it out on Facebook Live.
Yeah, so Dr. Charlie Rouse and Dr. Thelma Wiley-Lucas has already partnered with Tanner, but really has done an excellent job with. We had a vaccine clinic in an underserved area of Carrollton recently, and partnered with a church that provides services to the homeless, and so those vaccine clinics are already underway for underserved areas and homeless persons. We've also, Dr. Rouse has already partnered with several churches in the area, so that those efforts are really underway, and it was a really joyous vaccine weekend to participate in. And I would go to, I believe he has information on his website, and I think that Tanner also has information on our sites about upcoming clinics with Dr. Rouse and Dr. Lucas, spearheading those efforts.
All right, I may have time just for one more question here before we promote the walk-in event. And we've talked about this before. I've talked with other doctors. We've done several stories on it. But again, somebody has brought it up, so let me bring it up to you. it seems that flu cases haven't been up as high as they normally have been last year. Why is that? And the question always is, are those being lumped into COVID with COVID?
No,
numbers?
we just haven't seen a flu season of significance whatsoever. I think the main reason is, our infection prevention strategy for flu prevention in the hospital is masking. We call it droplet precautions. So masking, even the proportion of people that did mask have been very efficacious at preventing flu. Plus, flu has a much shorter incubation period and period of infectivity than COVID. So it was a little bit shocking for us to see how well we can curb flu if we just did a better job wearing masks. And, that's something that other countries, particularly in Asia, have known for years and have a large mask acceptance rate. And so that's why we just didn't see a flu season. The masks worked for that better than we could have ever imagined.
All right, Dr. Laura Larson, our guest on this morning's Community Voice. Thank you very much, Doc, for joining us and keeping us informed. And thank you for listening at home this morning to the Community Voice. Time right now is 9 o'clock. Enjoy your Tuesday.
Thank you.